Hey everyone, today we're diving into a topic that's crucial for men's health but often overlooked: the prostate. Let's talk about something super important for men's health: the prostate. The prostate is a small gland located just below the bladder and in front of the rectum. It plays a key role in the male reproductive system by producing fluid that nourishes and transports sperm. It affects how you pee and is important for having kids. The prostate surrounds part of the urethra, the tube that carries urine and semen out of the body. Because of its location, any issues with the prostate can affect urination and sexual function. Keeping your prostate healthy is a big deal for feeling good overall. Regular exercise, a balanced diet, and routine checkups can go a long way in maintaining prostate health. Activities like jogging, yoga, and even simple stretching can help improve blood flow and reduce the risk of prostate issues. If you don't take care of it, you could have some uncomfortable problems, even some serious ones. Conditions like prostatitis, benign prostatic hyperplasia (BPH), and prostate cancer can cause significant discomfort and health complications. Symptoms might include difficulty urinating, pain in the pelvic area, or even blood in the urine. Taking care of your prostate can make your life a lot better. By staying proactive with your health, you can enjoy a higher quality of life. Simple lifestyle changes like eating more fruits and vegetables, reducing red meat intake, and staying hydrated can make a big difference. As men get older, they can have some health things to watch out for. Regular screenings and discussions with your healthcare provider are essential. Early detection of prostate issues can lead to more effective treatments and better outcomes. Knowing about them is the first step to staying healthy, and prostate health is definitely one of those things that needs attention and care. Educate yourself, talk to your doctor, and take proactive steps to ensure your prostate stays healthy. Remember, a healthy prostate contributes to a healthier, happier life overall. So what is the prostate anyway? It's a small gland about the size of a walnut that sits below your bladder and in front of your rectum. It's a key player in the male reproductive system. The prostate makes a special fluid that keeps sperm healthy and safe. This fluid is really important for sperm to do their job. As men get older, the prostate can get bigger, which can cause some problems. Getting bigger is normal as you age, but it can sometimes be uncomfortable. Knowing how the prostate works helps you spot any potential problems. Two common prostate problems are BPH and prostatitis. BPH is when the prostate gets bigger but isn't cancer. It can make it hard to pee. Prostatitis is when the prostate gets inflamed or swollen, which can be painful. Both BPH and prostatitis can make a man's life pretty tough. They can cause pain, discomfort, and even trouble sleeping. Knowing the signs of these problems is really important so you can get help quickly. Prostate cancer is one of the most common cancers in men. It affects the prostate gland, which is a small walnut-shaped gland that produces seminal fluid. This fluid nourishes and transports sperm. The prostate is located just below the bladder and in front of the rectum. Prostate cancer happens when cells in the prostate grow too fast and out of control. Normally, cells grow and divide in a controlled way, but cancer cells grow and divide more quickly. They can form a mass called a tumor, which can spread to other parts of the body. A few things can increase your risk of prostate cancer, like getting older, family history, and your background. Men over the age of 50 are at higher risk. If your father or brother had prostate cancer, your risk is higher. African American men are also at a higher risk compared to men of other races. Early prostate cancer often doesn't have any symptoms, so regular checkups are super important. A prostate-specific antigen, PSA test, or a digital rectal exam, DRE, can help detect prostate cancer early. Early detection can make a big difference in treatment and outcomes. If there are symptoms, they might include needing to pee a lot, especially at night. You might also feel like you need to go urgently, but then have trouble starting to pee. This can be frustrating and uncomfortable. Other symptoms can include pain or burning when peeing, which can be a sign of an infection or other issues. You might also notice that your urine stream is weak or stops and starts. Blood in your pee or semen is another symptom that shouldn't be ignored. This can be alarming and is a clear sign that you need to see a doctor right away. These symptoms can be signs of other problems too, so it's important to see a doctor to figure out what's going on. Don't wait for symptoms to get worse. Early diagnosis and treatment can improve your chances of a better outcome. Regular checkups and being aware of changes in your body are key to staying healthy. Section 5. Early detection and screening, your best defense. Finding prostate cancer early is the key to treating it successfully. Regular checkups are really important for catching it early when treatment works best. The two main tests are the PSA blood test and the DRE. The PSA test checks the level of something called PSA in your blood, which can be high if you have prostate cancer. The DRE lets the doctor feel the prostate for anything unusual. These tests might be a little uncomfortable, but they're super important for finding problems early and getting the best treatment. Section 6. Navigating treatment options. Treatments for prostate cancer depend on how advanced the cancer is, how aggressive it is, and your overall health. Options include active surveillance, where doctors keep a close eye on the cancer, and more serious treatments like surgery, radiation, and hormone therapy. Choosing the right treatment is a personal decision, and you should talk to your doctor about it. They can help you understand the pros and cons of each option and make a plan that works best for you. Section 7. 2024 Guidelines for Prostate Cancer Screening. There are new guidelines for prostate cancer screening in 2024. These guidelines have been meticulously developed by leading experts in the field, taking into account the latest research and advancements in medical technology. They aim to provide a more tailored approach to screening, ensuring that each patient receives the most appropriate care based on their individual risk factors. The new guidelines emphasize a more personal approach, looking at things like your age, family history, and background to decide how often you should get checked. This means that instead of a one-size-fits-all recommendation, the screening process is now more customized. For instance, men with a family history of prostate cancer or those of certain ethnic backgrounds may need to start screening earlier and more frequently. The goal is to avoid unnecessary tests and treatments while still finding cancer early in men who are more likely to get it. By focusing on those at higher risk, the guidelines aim to reduce the number of false positives and the potential side effects of overtreatment. This approach not only helps in catching cancer early, but also in reducing the anxiety and stress associated with frequent testing. These new guidelines are helpful for doctors, giving them a plan to make smart decisions about screening based on each patient. They provide a clear framework for healthcare professionals to follow, ensuring that they can offer the best possible advice and care to their patients. This is particularly important in a field like prostate cancer, where early detection can significantly impact outcomes. Staying up to date on these guidelines is important for both patients and doctors. For patients, understanding the new recommendations can help them make informed decisions about their health. For doctors, keeping abreast of the latest guidelines ensures that they are providing the most current and effective care. Regular updates and continuous education in this area are crucial for maintaining high standards of patient care and improving overall health outcomes. Section 8. Lifestyle changes for a healthier prostate. While you can't control everything about your prostate health, making healthy choices can make a big difference. Staying at a healthy weight by exercising and eating a balanced diet can lower your risk of prostate problems. Eating lots of fruits, vegetables, and whole grains is especially good. Cutting back on alcohol and not smoking are also really important for a healthy prostate. These changes are simple but can have a huge impact on your overall health, including your prostate. Section 9. The importance of proactive prostate health management. Taking care of your prostate is important for men of all ages. Don't wait until you have problems to start taking action. Regular checkups, talking to your doctor, and a healthy lifestyle are the best ways to keep your prostate healthy. Remember, finding and treating problems early is key. By taking care of your prostate, you can live a better life and lower your risk of serious prostate problems. Knowledge is power, and taking control of your prostate health is a step towards a healthier and happier future.